Good morning, students. Today we will see about records and reports. This is a records and reports is a legal document. It is a often asked question in a fundamental of nursing. What is records? Records is a clinical or the scientific administrative legal document relating to the nursing care about the family, about the patient. Information is called the recorded information is called the records. In this class, today we will see about what is the uses of record, what are all the types of records, what is types of definition of reports, what are all the types of reports, what is the role of nurse in recording and reporting, what is the current trends in recording in a healthcare industry. Clear? What is called records? What is the principles? We have seen what's records. What are all the principles of record writing? Record writing always should be a legible handwriting. It should be written in a blue or the black in ink. It should be written in clearly and appropriate and accurately. Never postpone. Immediately you have to record. Use a standard abbreviations. Not use any jargons. It should be brief and complete. It should have a date and time and the signature of the nurse, and it should avoid the errors. If error coming, you just don't use a whitener. You can cross it and write and put your initial and date. It should be confidential. Record should not be taken click a photo and send it to somebody. It's illegal, it's unethical to us a nursing professions. What is the types of records? What are all the records you are coming across? First is a patient record. What it does having? Patient record have all information about the patients in a form. Okay, a medical record about the physical examination, doctor's order, progress report, pathology report, lab results, nursing record, discharge summary, all confidential information about the patient. Staff record about the vaccination, staff leaving, duty timing, any memos and orders, any in-service education they have underwent, CPR or bending or medications, course is pending, everything will be having. Ward record. What is ward? Everything will have admission record, discharge record, crash code record, inventory record, equipment record, and the infection surveillance record, staff assignment record, and shift record. All will be having. Then will be the administrative record, like a interview, how many interview people and how many like a disciplinary action what they have taken, case books, grievance, sexual harassment, office secrets, census desk. These are all the records are maintained mainly in the hospitals. Next we will see what is the role of nurse in maintaining the record. The nurse has to immediately recording. You have to do the immediate record. Use the standardized form in recording. Each entry with a date and time. Use blue or black pen. Legible handwriting. Signature of the patient is necessary, means you have to get the signature. Write in a factual. No jargon should be used. No abbreviation should be used. No offensive statement. Harassing words should be avoided. It should be in a ethically, you have to follow the ethical principles, right? Okay. What is the uses of maintaining the records? We are telling that you have to use types, records, and why this one? You may work in this organization today, you may leave the organization tomorrow. The records only, it's communicating the information to everyone. It is also used as an educational tool, and it is used for the research purposes. It's helpful for the auditing. It's helpful for monitoring. It's act as a legal document. It act as a administrative purposes. It's guidance purposes. For the retrospective research, the records are much useful. Prospective research, the future records, every time recording, it's useful for the prospective research. It acts as an evaluation tool, assignment tool, and it is also act as a teaching tool. The great record, we can identify the trends of admission in the hospital, trends of diseases in the particular time. That's why the research can do it. Which kind of patients are admitted from the which month to which month. So you can prepare it, and the administrative plan they can do it, like a staff admission and everything. Hope you understand about the records. Let us see what is called report. Reports are the oral report or the written. It enhances the information shared between the health professionals, like healthcare workers, in a many ways. It is called the report. What is the purpose of this report? It's also acting as a communication tool. It is act as a aid in a planning purpose. It's measure the service rendered. It illustrates the progress, what's going on, and it act as a teaching tool. Okay, most of the time, though records are there, will give the oral report when the duty is finishing. It's a endorsement report the nurse is giving to the another nurse. What are the types of reports? 24-hour report, census report, anecdotal report, and birth and death report, and incidental report. Any incident had happened, records as well as in the phone you have to inform the higher official that is the incident had happened. After the report, you can write the record. Criteria for maintaining the good report: make it promptly, immediately. Sometimes you are breaking the narcotics are missing, immediately phone to the authority, then immediately make it recording. It should be clear and it should be concise and it should be complete. Have a clear date of information. It should be well organized. It should be emphasize the important point, not talking unnecessary points. It's a point Important point has to be stressed in a many way. If oral report express clearly, present it in a clear manner, it should be very interesting manner you can present it. It is helpful for the further nurse to continue the correct and prompt care for the next duty. What are the advantages of reporting? It's like a monitoring the operations and controlling, guidancing decision, employee motivation, performance evaluation. What is the limitations or the disadvantages? This is like a time consuming. It's so expensive sometimes. It can be biased. If your more patients are there, it may be biased. It may be unrealistic giving, and technical reports not easy to understand sometimes, and tone and the voice, it is a matter whether the it is a novelty will not be there if your tone and voice is not so good, monotonous, too general, it is not so interesting, and no confidentiality is there. Somebody may listen to you when you are reporting. Okay, problems in the report. What is the problem? Non-communication. Sometimes miscommunication. You say some words English. Sometimes the language miscommunications, and sometimes it's really confusing the and unclear sentences. Your language is not so good. The report will be collapsed, and then incompetence sentences or incomplete sentences will create a much problem for the listener. And role of a nurse. What is the role of nurse? You have to follow the ethical principles always. You must be a honest person. You must tell only the facts. It should be accurate. It should be complete. It should be current. And it should be in an organization level what they are expecting, and the confidentiality also has to be maintained. So how the confidentiality can be maintained? You have to see that the report you have to tell, sister, the clear information I have written in the my written record, so that in the report you can still insist the other person to read the record, so that in that way in the reporting you can maintain the confidentiality. Thank you.